Hello everybody, I'm very pleased to be with you today. It will be difficult to present after you, Rihanna. It was very, very complete, and especially that your English is better than mine.
I'm sure your English is great.
Okay, so today we'll talk about the advantage of association microneedling RF with the plasma, the cold plasma, and what's the advantage of these, the benefits of these techniques for enhancing the drugs delivery and to have better results on the skin. So I tried, I did my presentation by on two sessions. First of all, I will give you a little bit of information about the radio frequency microneedling, but Rihanna already gave you a lot of things. After that, I will tell you a little bit about the plasma, which still the plasma is still a little bit unknown treatment. We don't know really how it works, but I tried to give a lot of information about that. And after, I'll finish with the benefits of combination, because I did a little trial in my clinic. I started 2 months ago on 2 patients, and I treated them with the combination on each part of the side. One side they got only 1 treatment, and on the other side they got the 2 treatment. And I have noticed that there's better result on the side that in which we combined plasma and radio frequency microneedling. So why to combine? The combination of these 2 treatments will enhance, as you know, the drug delivery on the skin and rejuvenation by working synergistically to improve the penetration and absorption of topical medication. We have too many indications for this treatment, particularly in dermatology, and especially for scars, atrophic scars, for hypertrophic scars, stretch marks, keloids, hyperpigmentation, and Rihanna talked about that, dilated pores, and skin tightening, and for wrinkles. What is radio frequency microneedling? As you know now, because you know everything about it, it's radio frequency, it's dermatologic fractional therapy for skin aging treatment. So the advantage of that, it will be combined the radio frequency and the microneedling, and we have 2 effects. We have an injuries caused by the microneedling, and we have the effects, the thermal effect, which will be caused by the radio frequency. So it's non-surgical treatment, which is used for skin rejuvenation and tightening. We have two kinds of needles. You have the non-insulated needles, and you have the insulated needles. The insulated needles, the energy will be delivered only on the tip, and the advantage of that you will be able to choose, especially the depths in which you can work, and it's very good to treat phototype 4, 5, and 6 without any danger. While when you have an insulated, non-insulated needle, you will have the energy which will be delivered all over the length of the tip, and you have more damage, thermal damage that will be delivered, and you have more effect. So it depends, and we will see that together on the phototype, on the indication. You will choose the kind of needle that you will use. So the radio frequency energy hits the deeper layers on the skin, stimulating collagen and production. This device, as HIFU as other devices, indicate to produce collagen and elastin, and the combination of radio frequency and the microneedling will enhance the effectiveness of the treatment, because we have the micro injuries that will allow the absorption of medical topication, and the radio frequency energy that will tighten and firms the skin. So what are the advantages of radio frequency? As you know, in contrast of most lasers that target specified chromophores, radio frequency with frequencies around 100 megahertz don't need chromophores, and it can be proven that in the last decade that to be safe and effective for both non-ablative skin tightening of the face and body, and the fractional radio frequency skin surfacing for skin rejuvenation and acne scars. As you know, chemical peels and lasers, after that kind of treatment, we can have we can need after that a period of social eviction, which can be less with the treatment with less downtime with comparing with microneedling, because when you have a treatment with microneedling, usually we have one day of return maximum, and at maximum 5 to 7 days of microplastic around. In fact, when you have this kind of treatment, you don't have risky comparing to the exposing to the sun, and you don't have a big non-exposure, less downtime period being at home without being exposed to the people. So how does it work? You have the needles, and you saw that in the video with Joanna. The needles are inserted to the skin by a specially designed electronically controlled smooth motoring motion. Once the needle reaches the depths, it will deliver the energy and the radio frequency, the energy, and the energy is emitted, damaging the skin around. When you use a radio frequency with non-insulated needles, so the energy is emitted all over the skin, the length of the hole. But once you are using with an insulated, you have the energy only on the tips on the hole. It will allow, this how it works. It's always follow the path of least impedance of the skin between epidermis, where you have a high impedance, and dermis, where you have a low impedance. That's why it penetrates, and you have always electrothermal damage, which is delivered to the skin. And as you can see here, the non-insulated needle, you have some advantage with the non-insulated needle, because you don't need to do different passes, because when you have one shot, the radio frequency is emitted all over the length of the needle. So one shot is enough, and you don't need to repeat the passes, because you have one coagulation all over the needle. And you have less bleeding, because it will be coagulating, and as is heating the skin, you don't need antiviral treatment. However, when you treat with an insulated needle, you have sometimes to do several passes, because you have to reach different depths on the skin. And usually with this kind of treatment of needles, you have bleeding, and you have more erythema. But with this kind of needle, with the insulated needle, you don't have a risk for the superficial part of the skin, especially for the dermis, and it's safer to treat phototype 5 and 4. Especially for hyperpigmentation with kind of needle. So you saw this slide before with Rihanna. And on the higher one here, you can see the insulated needle, and as you see, the energy is delivered only on the depth that you choose, and you can even on the same treatment do several passes. You can go, for example, up to 3.5, and then go up to 2, and then treatment superficially. When you treat with an insulated needle, you have the energy which is delivered all over the tip, the needle, and you have between the needle a electrothermal damage zone. This zone will be the zone of coagulation of the skin, and will be where you will have this process of neocollagenase and neoelastin. You can see it on this slide. Here we have only the energy delivered here. In that way, we have a non-insulated needle, and the electrodermal thermal damage is all over the needle. This area will be electrothermal, and sometimes, especially with phototype 4 or 5, you have to give cold, because otherwise we can have hyperpigmentation. And you can see it on this slide. We can see the coagulation zone on 0.5, on 1 millimeters, 1.5, and on 2 millimeters, and even on 3.5. This slide has been magnified 10 times however, these slides has been magnified 4 times. So, what are the parameters? How can we do the treatment? Usually we apply the topical aesthetic cream with occlusion for 30 or 40 minutes. It's enough for me. Especially that with the gentlo, the needles are very sharp and they are not very thick, around 200 micrometers. That's why the treatment with this device is less painful than other competitors' devices. So we choose the range and the depth of the needle from 0.5 to 3.5, depending on the anatomical site and pass number. For example, if you are treating the eyelid, you know that the skin depth is up to between 0.5 and 1 millimeter. So in this area, you would choose around 0.5 or 0.4 because with this device you can go to 0.4. So it's better on some areas at the eyelid to go for 0.4. When you are treating, for example, an area as a jawline or the other part of the face, you can go with different passes. If you are using a non-insulated needle, one pass is enough, and then you go to 3.5 because you will have the energy which will be delivered all over the tips. But if you are using an insulated needle, and then you will choose different passes, for example, 3.5 and then millimeter, then 2, then 1.5, to be able to have different kind of different passes and different zone of coagulation all over the depth of the skin. And then you can fix the power, because you can put power 1. You start. Usually I start with 4. I put it on 4, and if the patient does not suffer, I raise it to 5, even to 6, and I can go even to 9. But usually, for mostly of my patients are between 6 and 7, and they support it without any pain. And then the exposure time is very important, because when you have the needle inside the skin, you have a time of emitting of the radio frequency energy. It's the time of heat. For example, if you put 50 milliseconds, which means that the needle will deliver the energy for 50 milliseconds. When it's like that, it will depend of the skin and of the phototype. For example, if I'm treating a phototype 5, when I put, for example, 100 milliseconds of energy, I put a 200 milliseconds of time of delay time to make the skin be cold, to avoid having hyperpigmentation and inflammatory reaction. And then the number of passes, we talked about that. It will depend if I'm using which kind of needle and of the area of the indication. Someone asked for about skin or scar skin, for example, a few minutes ago. If I'm treating with scar skins, I will use different passes, and because I need more to be more aggressive with the skin, to have more reaction. And then the treatment session, Rihanna talked about that. Usually we announce to our patients before, but we know that we are usually between 2 and 4, and 3 is a good range, but in some cases we can go up to 6. I want to tell you that when you do a treatment with radio frequency, you have a result still working up to 6 months. You can see results, and that's why a range of 4 sessions is good, and then you tell your patient to wait a little bit and then come back in about 2 months, and then we decide if you have to go for another session or not. So how does it work? You have PCR studies reveals an immediate increase of interleukin and TNF alpha and matrix metalloproteinase 13 and 1, and the heat shock protein 72 and 47, and growth factor transformant, which will increase 2 days after the treatment. So once you do the treatment, starting the 2 days, we will have a modifications of all these enzymes, and you will have a significant inflammatory response, which will start 2 days after, and it will continue up to 10 weeks. So up to 10 weeks, you will have a modeling in the tissues with increasing the collagen and elastin. So you will have also the vigorous wound healing of the skin. So the combination of the healing of the skin and then the effect of the radio frequency on the skin, which will make the treatment which will lead to neocollagenesis and neoelastogenesis. So on this slide, you can see before treatment and immediately after treatment here, and then 2 days, 14 days, and these two slides are at 28 days. This is the area that had been treated with radio frequency, and we can see that with the histology we can see that we have a coagulated and elastin zone area, and around that we can have the viable tissue. Around the arrows, the white arrows, we can have the viable tissue, and we can detect that in that area we have up to 28 days post-treatment, we have increasing of the inflammatory cells that we can see in blue around all this area, which will increase the neocollagenesis and neoelastogenesis. We can see it much better on this slide, and we can see that we have a new collagen and on the 28 days after the treatment. On this one, this one has been magnified 4 times and this 10 times, and we can see that we have an area with new collagen 80 days after the treatment. So what are the indications? The indications are the facial wrinkles, the skin sagging, acne scars. We have also the post-operative scars, the stria, the sash mark, the dilated pores, and the skin rejuvenation. Here are some results from my patients. I'll put you some results. So, on this slide, you have a female 45 years, and here we have female 62 years, only 1 month after one treatment. And you can see the sagging area on the jawlines. We have already a good result after one treatment, and this is already good. But as we know, with this kind of sagging, we program around 3 sessions. Here's a result on the abdominal sagging skin after lost weight. Female 31 years, 1 month after 1 month treatment. And in this slide, we can see on a male, on acne scars, results after treatment, after 2 treatments. And these are results without any combination. You will see with other slides with combination, and personally, I use it with combination with mesotherapy. And as Rihanna said a few minutes ago, you don't have to put the product and then the energy, because the energy will dissociate the solution. That's why you apply the radio frequency and then you apply the mesotherapy after. This is on scale. And this is on dilated pores. So these results are not mine. The results we saw before, it was my patients. And you can hear the enhancing of the jawline. So that's what I can tell you about the microneedling, and then let's talk a little bit about the plasma. So the science behind the plasma technology relied to the unique properties of plasma, which is a ionized gas, This gas will be shocked by electric voltage that will give an arc, an electrical arc that will hit the skin and cause the effect on the skin. What kind of gas we can use? Usually we have helium gas, argon, or mixture of gases. The electrode that will create a uniform electric field and prevent electrical discharge to the surrounding. You know that we have two kinds of plasma. We have the hot plasma that will burn the skin, and we have the cold plasma. In this presentation, I'm talking to you about the cold plasma, because the heat plasma is different, and as you know, with the device of Gentlo, we have the cold plasma that it is associated to the radio frequency. So the high voltage is applied to the gas, which it will ionize the gas molecules, creating a plasma discharge that will have with high reactive species. These species will target the skin and will penetrate it and will induce various biological effects as antimicrobial, antifungal, and antiviral properties. The wound healing and tissue regeneration, cell migration, proliferation, antigenesis, human response, tissue regeneration, and cancer treatments, all these indications can be treated by cold plasma. This is the device. So here we have the electrode that will stimulate the gas and provide the arc that will go onto the skin. So when you apply it, the plasma effective nutrients will be dissolved temporarily to the skin and break up the molecules of the cell adhesion, which will help the ingredients or the drugs to penetrate the skin. As you can see on this slide, we can apply a plasma treatment on all kinds of ampoules with high and low viscosity, and you can see that once I apply the plasma, the product here it was. And that on the right one, on the left one is me. We have it without and with plasma, and when you apply plasma, the product will be more less corrosive and it will penetrate. So what are the indications? Antimicrobial, antifungal, and antiviral properties, wound healing and tissue regeneration, cell migration, proliferation, and cancer treatment. It was very important to use it for hair loss and for RAS, acne, and onychomycosis because it has an effect on the DNA of the cells. And we can also use it in aesthetic for scars, acne, wrinkles, skin texture, skin spots, and skin pores. And it's very important, as Rihanna said, to associate it, for example, in spots, because for pigmentation, hyperpigmentation is very good treatment, especially when you put drugs like vitamin C and some drugs that will depigmentation for the pigmentation. So it's important that you know that the exact mechanism of the plasma is still unknown. We don't know how it works. However, we have what we know that it's very efficient, and many studies have been realized by OTAC, which is an organism that realized study on the skin. And with this, when they did these studies, they did it for the skin pores, for example, and for the superficial wrinkles, and they've noticed after only treatment with plasma that we have enhancing and good results on this on the superficial wrinkles and the hydration of the skin, hydration of the skin and the skin pores only with the plasma treatment. So the results are stimulating of the cell regeneration, production of collagen and elastin, reduction of the lines, fine lines of wrinkles, improving of the skin texture, age spot reduction, skin tightening, and Especially, it's to maximize the topical drug delivery. It's very important to use the plasma too in this indication when you have another device, because you can combine the two devices, and that's what we'll see after. So on this picture we can see a lady that has been treated only with plasma associated with treatment by peeling and vitamin fruit acids. The range of cosmetic is Genesis, and she got a treatment for 4 months, and as you see, without any treatment, other treatment, she had a good results. Here we can see the rejuvenation effect with plasma, only with plasma without another treatment. So, now we are talking about the combination, why to combine. As you know, a large part of our patients today are more looking for screen quality than volume radiofrequency microneedling devices indicating to improve the deep layers for lifting effect. And as you know now, the plasma is indicated to improve the screen quality. That's why when you associate these two devices, we have a biostimulation, and the biostimulation is the key of success. So the screen quality is an important component of human attractiveness. It's a good screen quality represents healthy and useful in appearance. Underlying skin categories are tone, heaviness, surface heaviness, firmness, and glow. And skin categories affected by multiple tissues layers. Skin surface quality can be stemmed from and be impacted by deep structures or tissues. Improving skin quality requires a multi-layer treatment strategy, and this is the important point, that we need to work on all the layers. You cannot treat only the superficial layers to have a good skin quality. And that's why the combination of these two treatments are important, because with the radiofrequency microneedling, you will treat the deep layers, and then with the plasma, you will have effect on the superficial layers. And that's what we can see here. With the treatment of the plasma, we can have a superficial effect, mostly to the epidermis and the superficial dermis, where with the radiofrequency microneedling, we can go down up to 3-5 millimeters in the dermis. So the studies you will show have been carried in my clinic. 2 female patients, 71 years old and 56 years old. Both patients has been treated with radiofrequency microneedling, but on both sides, and they got a treatment with NCTF. NCTF is a polyrevitalization mesotherapy solution, and they got this treatment on the left part of the side of the face, and we can see the results 1 month after. So here we can see that here the lady has been treated both sides with radiofrequency, and on the other side, on the left side, she got mesotherapy and a plasma with mesotherapy, and you can see that the lifting effect, and you can see it even better on this lady, has been better improvement with the side that she got the both treatment, because the plasma with the mesotherapy enhanced the result of the radiofrequency. So, to conclude, the combination treatment is particularly important in the field of dermatology due to its numerous benefits. Firstly, it allows for targeted delivery of medication to specific areas of concern, such as acne scars, hyperpigmentation, or wrinkles. By passing the skin's natural barrier, the drugs can reach deeper layers and exert their effect more effectively. So radiofrequency and plasma stimulate collagen production, which is crucial for maintaining youthful and healthy skin. Collagen provides structural support to the skin, keeping it firm and elastic, and as we age, collagen production decreases, leading to the sagging and and other signs of aging. By promoting collagen synthesis, we will have better effect. That's why the combination of this treatment help to improve the texture and reduce the fine lines and restore a more youthful appearance. Thank you, and I can answer the question.